belong to a generation that is stepping forward right now. We're the generation that lived through school shootings, that served in the wars after 9/11, and we're the generation that stands to be the first to make less than our parents unless we do something different.
There you see Pete Buttigieg, just 37 years old, wrapping up his second term as mayor of South Bend, Indiana, now running for president and out with a new book, Shortest Way Home. Mayor, thank you for joining us this morning. Good to have you.
Thanks for having me.
So you said the bumper sticker for your campaign is freedom, democracy, security. I think everyone is for freedom, democracy, and security. But what exactly does it mean to you, and why are you the best person to deliver on that promise?
Well, for example, when we talk about freedom, I think Democrats need to be much more comfortable getting into that vocabulary. Conservatives care a lot about one kind of freedom, and it's freedom from regulation, freedom from government. But certainly in my life experience, there are a lot of things besides government that can make you unfree. You're not free if you can't start a small business because leaving your job would mean losing your health care. You're not free if you can't marry the person you love because some county clerk is imposing their interpretation of their religion. You're not free if you can't sue a credit card company even after they get caught ripping you off. So I think we need to have a much richer, much thicker discussion about what it truly means to be free in this country. And I think it falls to Democrats to lead the way on that.
It's a big leap from mayor of South Bend, Indiana, a little over 100,000 people to the Oval Office. Do you know what you don't know about being president?
Look, I get the audacity of somebody like me talking about running for this office, but frankly, it's a leap for anybody who arrives behind that desk. And yet, all of the people who've had that job have been mortals who just bring their experience to the table. My experience is that of guiding a city through a transformation, and I think a mayor at any level has the kind of executive, frontline government experience, and by the way, problem-solving experience that we need more in Washington right now.
You said you're for Medicare for all. I want to talk about some of the issues in the campaign. You're for it, but isn't Kamala Harris, who's also running for president, right when she says that means doing away with private insurance?
I don't see why it requires that. I mean, after all, if the framework we're using is Medicare, a lot of people who have Medicare also have Medicare supplements, Medicare Advantage, something like that. There can be a role for the private sector, but just leaving people...
But you're for a single-payer system, aren't you?
I think so. I think that's the right place for us to head as a country, and we can debate the finer points of how to get there. But I've been in countries, look, I studied in the UK where there's not only single payer, there's nationalized medicine, which we're not calling for. Even there is a role for the private sector. I just don't believe that leaving Americans to the tender mercies of corporations is the best way to organize the health sector in this country.
But in single payer, you would be replacing private health insurance.
Yes, at least as again, Medicare for all is the best framework, right? So if we want to make Medicare available to everybody, whether it's as a public option to buy in or simply establishing that as how the payer structure works in this country, that's going to be the center of gravity. And the bottom line is we need to make sure that every American is able to get health care.
How are you going to sell that? When President Obama, and he didn't get rid of all private health insurance, he said, if you like what you have, you can keep it. He was scorched by those who couldn't keep their plans. You'd have single payer. Eventually, that would mean doing away with everyone's plans. How can you possibly sell that in this country today?
Well, you have to make sure that it leads to better results. And if we need a gradual way to get there, then we can start with Medicare for all who want it by making some version of Medicare available on the exchanges for people to opt into as part of the pathway to Medicare for all, so that you can try before you buy, so to speak, as a country. Look, there are a lot of ways, and in the course of this conversation, we're going to get into a lot of the different frameworks that are paths to this. But the bottom line is most citizens in most developed countries enjoy access to this kind of health care, and Americans don't. It's wrong. And one very interesting thing when you talk about the experience in the Obama years is the short amount of time in which ACA went from a political loser. I mean, I remember what it was like to be a Democrat in 2010 as those town halls happened. And by 2018, it was perhaps the winning issue for Democrats, because when we saw what those steps actually meant, when we saw how they made our lives better, we realized that all this crazy conspiratorial talk about death panels or the horrible things that will happen if we don't make sure there's a big corporate role in our healthcare system, a lot of the things we're being sold don't actually come to pass in the real world.
Let's talk about foreign policy. The situation in Venezuela is heating up. President Trump doing what he can to push Maduro out. Do you agree with his approach?
Well, I agree with the fact that Maduro has lost his legitimacy, but when you see the kind of saber rattling, by the way, by some of the same people who led us into the war in Iraq, I think it is extremely irresponsible to talk about committing American troops to what could wind up being a proxy war with countries that have claims on Venezuelan oil. Look, if we're going to use sanctions, that's a legitimate part of the U.S. foreign policy framework and toolkit, but they should be targeted toward making sure that there are new legitimate elections so that the Venezuelan people can determine their future.
How about North Korea? Given where things stand right now, would you meet with Kim Jong-un?
Well, I think it would make more sense to have that happen in a framework of concrete achievements. You don't just get to have a meeting, declare the nuclear threat to be over, then wind up, of course, being embarrassed and contradicted by your own intelligence chiefs. You know, as a military officer serving overseas, I was part of the intelligence community, and there is not a more reality-based group of people in this country. You actually have to understand and legitimize and take seriously their assessments before you have any business having a one-on-one with the leader of a hostile foreign power like North Korea.
You are openly gay, married, but you've only been out for the last few years. Any concerns the country's not ready for a gay couple in the White House?
I think there's only one way to find out. But, you know, when I came out, it was in the middle of a re-election campaign. I just reached that point in my life where I was ready, and we didn't know what would happen. I'm from a socially conservative community. Mike Pence was the governor of Indiana at the time, and I just did it because it was time. That same year, I wound up getting reelected with 80% of the vote. So I think the lesson we learned is that people are prepared to get to know you and judge you based on the quality of your ideas and your experience and your work. And I trust that America can do that too. There's only one way to find out for sure.
Mayor Pete Buttigieg, thanks for joining us this morning.
Thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.